Improving your outward appearance and feeling like you look your very best can improve your mental health and your physical well-being and your confidence that you can handle whatever life throws at you. But which of the many anti-aging procedures we hear about is best for you? Well, we welcome Dr. Christina Captain, Doctor of Acupuncture and East Asian Medicine at the Sarasota Center for Acupuncture Nutrition. Wait a minute. Are you saying that acupuncture is going to fix this? It can make me beautiful?
Of course.
Good. Sign me up. Mind-blowing. Tell me about that.
So it's a totally different system, right?
Okay.
Cosmetic acupuncture really focuses on the skin of the face, obviously, and the whole body. So after an actual diagnosis in Chinese medicine, which is going to ferret out your basic constitutional pattern and how we can improve that with basic acupuncture or full body acupuncture, then we turn to needles in the face to help develop elastin and collagen endogenously, meaning your body's going to make it on its own.
Yeah.
So this is not for people who want to have nip and tuck. This is not going to be like you're ready for a facelift, neck lift, fat grafts, all that stuff. That is primary to surgery, and we have some of the best plastic surgeons in Sarasota. I tell you, it's like a beacon of light on every corner. They are great, probably some of the best in the country. But if you're not ready for surgery and you don't want Botox because you've heard, maybe that migrates, you know, it's his botulism.
Right.
I've heard it migrates to the brain,
or fillers.
migrates to this, and maybe you don't want a filler because fillers can actually, if you don't have a very, very perfect professional master injector, fillers that are hard substances can actually occlude vessels in the face, causing necrosis, even vision loss. So what we want to do is, if you're not ready for surgery and you don't want to entertain Botox and fillers and other types of injections, this might be for you.
So am I hearing it correctly? This is for somebody like me, or a lot of us, let's say a lot of us, right, who would love people to say, what did you do? Did you get some extra rest? Did you go on a spa vacation? You look like your skin looks fresher. You look rested. You look a couple years younger. Is that the kind of goal we're getting?
Exactly the case.
I'm sorry, what's the number again?
This is what, yeah, right. This is my patients. Here's what happens. And this is how I talk to patients when they come in.
Yeah.
I say, you know what's going to happen? It's going to be, you're not going to be like, you know, windblown, tight face, but it's going to be like, did you lose weight? Did you color your hair? Like, why do you look so glowy? Why do you look so fabulous? Yeah. And you know, you'd think that it was people that are in their 40s and 50s and 60s and 70s and beyond, because in Sarasota, you know, like I think what, 90s the new 40? I don't know. But what I can tell you is that it's for people that are even in their 30s and late 20s. Yeah. They're going to get Botox now.
Starting new careers, new moms, you know.
Getting married.
Exactly, right? All of that stuff. So I come into your office and what happens?
Right, here's what happens. We talk about what you want to do. Right? What's your main focus? I love it when I come and see a patient or come to meet a patient and they're like, you know, I see them and I go, oh, this is what really can happen. And they say, I just got this one spot like right here that I want to work with, right? And I'm like, fantastic. In order to get that one spot, we're going to do the whole thing. Right. Because it is it's a complete model. It's everything. It's not just, you know, one spot. We can't just do one spot. Not like I'm going to inject here. So what happens is you come in and I use a program called Mei Zen, which is beautiful person in Chinese pinyin. And that is developed by a Dr. Martha Lucas out of Colorado. And she's been around for 50 years practicing acupuncture and cosmetic acupuncture. And she is a brilliant clinician who developed that whole pattern diagnosis first and deciding how we're going to work with your main body and then your face. This is why we can address other issues at the same time, like sleep, which affects your face, like nutrition, which affects your face, like how do you take care of yourself, cortisol, postmenopausal issues, all of that, hormone balancing. All of that affects your face. So you come to see me twice a week for 5 or 6 weeks, and then you might have maintenance if you so desire.
No downtime.
No downtime.
No surgeries. No craziness like that. And like you said, nothing drastic. That's just a natural approach.
Small makes the pores smaller, makes the fine lines thin. Yeah.
Yeah. All right. And real fast, I know we're running out of time, but this is something that you take into effect for your whole body. There are different ways they can get more information on how acupuncture can help other parts of your body on the outside of your skin as well, right?
Yeah, for sure. Inside and outside. That's what we talk about.
Gosh, man, new year, new me. I'm learning so many great things. Well, of course, you can learn more at scansrq.com.